Thank you everyone for coming. I seem to get the popular ones, and so we're talking about House File 2056. I guess we could do it a couple of ways. We could either hear from you guys first, or we could just hear from the from all of you first, and just kind of go around in circles. And let's just take turns. We'll start there. This obviously is a bill regarding the dispensing of hydroxychloroquine and ivermectin over the counter. So we'll just start on this side. If anyone wants to speak, I also ask you, if you can, to come a little closer to the table. The mics, there's a lot of microphones up here. They probably pick up well, but if you could just at least lean a little closer to the table so we can hear you, that'd be great. Anyone over here? I'm looking. All right, we'll start over here. I can't see behind the column, but yes, sir.
Thank you for the opportunity to speak. My name is Wes Pilkington. I'm a pharmacy owner from Evansdale, Iowa, and the president of the Iowa Pharmacy Association. Pharmacists routinely dispense ivermectin and hydroxychloroquine when they're appropriate for the individual patient. The concern with this bill, as written, is the mandatory dispensing. The phrase "shall dispense" removes professional judgment at the very point where pharmacists are legally and ethically obligated to evaluate patient safety. Pharmacists are not vending machines. We're licensed healthcare professionals whose role is to ensure medications are safe and appropriate before they reach the patient. I want to briefly highlight the safety concerns associated with these medications. The following information comes directly from drug manufacturers and post-marketing data from the FDA. Ivermectin carries risks of severe skin reactions, drops in blood pressure, central nervous system depression, neurotoxicity such as dizziness, disorientation, encephalopathy, and impaired consciousness, as well as eye inflammation, liver inflammation, severe diarrhea, and nausea. These risks are increased when doses exceed those studied but as recommended by the manufacturer. Hydroxychloroquine presents even more significant concerns. Patients who take this medication chronically require routine eye exams, periodic blood counts, EKG monitoring for heart toxicity, muscle strength and reflex testing, and kidney function monitoring, particularly in elderly patients. It carries a risk of overdose and can cause fatal cardiac arrhythmias, severe hypoglycemia, blood disorders, irreversible retinal damage, lung disease, acute liver failure, and kidney injury. The patients I currently dispense this medication to are closely monitored by healthcare providers every few months to ensure safety. This bill raises critical unanswered questions. What prevents a patient from following high-dose recommendations found online and obtaining repeated prescriptions? What stops them from visiting multiple pharmacies or obtaining a new prescription every week or every month? What happens when an elderly patient with known cardiac or kidney disease presents for one of these medications, and I know that medication will cause them harm? This bill states that pharmacists would carry no legal liability for patient harm. But legal immunity does not erase our moral and professional responsibility to protect patients. This legislation effectively tells pharmacists that our clinical judgment is optional. That is not something we can stand for as a profession. I respectfully urge you to vote no on this bill so pharmacists in Iowa can continue to do what we are trained and licensed to do: protect patient safety and dispense medications responsibly. Thank you.
Lon Anderson, Polk County Medical Society, representing doctors, surgeons, and other medical personnel in central Iowa. We're not here to debate whether or not these drugs are safe or effective. I'm sure they are for some. Our concern is with the standing order. If a patient were to have an adverse reaction, we wouldn't be able to treat that person because it was given to them over the counter. And so, in general, we oppose standing prescriptions.
Hello, Seth Brown on behalf of the Iowa Medical Society, the Iowa chapter of the American Academy of Pediatrics and Rheumatology Association of Iowa. All registered against this bill. They all unanimously voiced concern about what type of precedent this would set, particularly, as was mentioned in the previous comments, treating pharmacists as a vending machine. Not having that clinical oversight and judgment would have adverse effects that we expect to impact patients long term. There are significant adverse impacts to these medications, particularly hydroxychloroquine. As mentioned, there needs to be clinical oversight and regular check-ins to make sure that it's being used properly. There are some medications where OTC use is proper. These are not those medications, and we feel like that needs to be distinguished here. Thank you.
Next, anyone else? Well, just one question for the pharmacist. Are there any other medicines that are dispensed with that require regular check-ins?
Yeah, I mean, most of the medications that I dispense require regular check-ins. Nearly all medications that would be used for diabetes, hypertension, they would require at least labs on an every 6-month basis.
Okay, so it's not unusual. It doesn't sound like to actually have. If this bill were to pass, what would be so different about this one?
So if this bill were to pass, who would be the ones monitoring the patients that receive this medication?
Okay.
Would be my counter question.
Well, they do have the assumption is that they have a provider. The other question that I would have is, you mentioned a lot of the side effects. There are plenty of over-the-counter medicines that do have side effects. I mean, just the ones that we all know about, Tylenol, ibuprofen. They have a long laundry list of side effects, from liver to, I actually wrote some down here, to asthma, to blood pressure, to cardiovascular risk, to stomach and GI issues. What separates this one, and why are those okay, but this one is not?
Yeah, I mean, just simply speaking to the hydroxychloroquine, there isn't a medication that I know about that you can purchase over the counter that causes cardiac arrhythmias to the frequency that hydroxychloroquine does. There isn't a med that causes liver issues to the level of hydroxychloroquine. The risk of having a skin reaction to something like ivermectin compared to anything over the counter is extremely minuscule.
Okay, thank you. We'll go to the next one, and we'll reserve right to come back with questions. All right. Next one.
Hi, Lindsay Maher with Informed Choice Iowa. We applaud the efforts here to expand access to medications, giving Iowans choice in their treatments. Several states, including Tennessee, Arkansas, Idaho, Louisiana, and Texas, have already passed laws allowing over-the-counter access to human formulation of ivermectin without a prescription, as the federal regulators have unfortunately played gatekeeper in keeping this off-patent generic drug away from people. In 2015, this medication was awarded the Nobel Prize for its life-saving impact worldwide in humans. Research continues worldwide to uncover the various diseases that ivermectin is capable of treating, including autoimmune diseases, antiviral properties inhibiting viral replication and viral entry, and has shown promising preclinical impacts in vivo and in vitro studies for treating cancer by targeting multiple signaling pathways to inhibit cancer cell proliferation, including apoptosis and cell death. It has a proven safety profile. Billions of doses, especially of ivermectin, have been given worldwide, especially for treating parasitic conditions. It has serious side effects, that is true. A lot of things do. They are increasingly, or abundantly rare though, in standard human doses. Billions of doses have been administered globally for various human parasite issues. Severe reactions reported by the WHO Vigibase has 667 severe reactions between 2003 and 2020. Comparatively, Tylenol had 100,000 calls to poison control, 56,000 ER visits, and 2,600 hospitalizations in that same time frame, and continues to be one of the leading causes of acute liver failure in America. So it has established efficacy for proven uses. Requiring doctors' visits adds unnecessary burdens and delays treatments and could increase costs by not allowing these things to be over the counter. Many people in rural and underserved communities would have greater access if this was something they could purchase over the counter. We've unfortunately seen regulators step in and say, especially during the pandemic, whether or not doctors could prescribe this, including in the state of Iowa. We would like to know that if doctors believe this to be something beneficial for their patients, they could prescribe and have the prescription filled. Unfortunately, that did not happen. So there is a cost and convenience and savings, but with all drugs and biologics, there are never a one-size-fits-all. Never a one-size-fits-all, drug or biologic, that should be given to every individual. But we appreciate the fact that the attention has been made that the manufacturer label will be given along with this product so that the full safety profile can be evaluated by the patient themselves. They can read that insert, know that there are risks, and determine based on informed consent whether the risks or the benefits benefit them. Thank you very much.
Thank you. All right, seeing no more, there's one more.
Okay, my name is Heaven Chamberlain. I'm with Bitches Get Stuff Done. But most importantly, I'm a guinea pig parent. This makes sense because we give ivermectin to our guinea pigs. It's literally for animals to treat parasitic conditions such as lice, mites, and internal parasites. We actually have to get it through the LA guinea pig rescue because it's very hard to get. So I have to have it shipped from LA to Iowa. And I find this disturbing that we're taking medicine that is specifically for, I have it pulled up, it's specifically for cattle, horses, sheep, and camels. Why are we taking this as humans? That's my point.
Well, just to be clear, there are billions of doses that have already been prescribed to humans.
Yeah, for parasitic conditions. That is not OTC.
We're not talking about the animal formulas, we're talking about human formulas.
Yeah, but I've met people at the literal pharmacy who ordered horse dewormer from Mexico because they were sold a false idea by the pharmaceutical companies. The fact that pharmacists didn't jump across the counter is fascinating to me. But he bragged about ordering stuff from Mexico. And I never saw him again, so I don't know how that turned out for him.
But just to be clear, there's nothing in this bill that refers to what you're talking about, to
It
animal
doesn't matter. We're
formulas.
feeding people guinea pig medicine.
Thank you for your comments.
I'm Dan Twellmeyer, and I'm here in support of the bill, and I thank you for bringing it forward. I do want to talk about the human form of this. I appreciate the side effects that were mentioned. I wish those side effects on the COVID shot was mentioned when my daughter went to a physical, and the reason the COVID shot had to be offered is because the emergency authorization given to the COVID shot, no other therapeutic, right? Well, it is a therapeutic for the COVID shot. Dr. Mary Tally Bowden has treated over 6,000 patients with ivermectin, did not lose one. That's why we have this fight over ivermectin. It gets tweeted actually by the FDA. It's not a horse dewormer or whatever we want to label it as. And so that was disinformation out of the FDA that Dr. Mary Tally Bowden sued the FDA and won. They had to take down their tweet. Unfortunately, who knows how many lives were lost. Ron DeSantis is allocating $60 million for cancer, just kind of like Governor Reynolds. I met Casey DeSantis. We share a cancer survivorship story. I know people that take ivermectin have survived cancer using ivermectin. They are going to allocate and study ivermectin for cancer. Dr. Pierre Corey, who stood on the nation's capital fighting for stopping mandates like you did, Eddie, stood up for us, medical freedom. He wrote about the fraudulent trial on ivermectin studies. And I would like to just share that with you. So I think the safety signals are there that it's safe. It won the Nobel Peace Prize. It's been given 2 billion times. There's lots of risks out there. And I believe that it has the safe and effective pattern that people can go in and see the risk on the package to assume whether or not they want to assume that risk for themselves. So I encourage you to pass this bill, and I hope that it hits the floor and we can get it signed this July on Governor Reynolds' desk. Thank you.
Thank you. All right.
Give those to you too.
Are there, going once, going twice, are there any more speakers? All right, well, I will pass this on to Dr. Babe, Representative Babe, who I know is strongly in favor of this bill. I'm sorry. Go ahead, sir.
Let's recap here that we have folks representing Iowa's largest physician group, Iowa's largest pharmacist group, Iowa's nurse practitioners, Iowa's pediatricians, Iowa's nurses. All of the state's medical professionals have said that the evidence shows that the risks of these drugs far outweigh the benefits for this to be essentially dispensed by a pharmacist's vending machine. It's reckless. This bill is mandated medical malpractice. Why? I heard some references to COVID. Sure, you're going to get some small little trials in the early COVID. We didn't know what worked. We threw stuff at the wall and saw what stuck. What we finally learned works and doesn't work is through randomized controlled trials. Every single randomized controlled trial shows that hydroxychloroquine and ivermectin are both ineffective with COVID. Any other indication short of onchocerciasis or strongyloides is still experimental only. To make over-the-counter an experimental drug for people just to experiment on themselves completely undermines the reason why we have a drug prescription process in the first place. What's next? If we have, a small group of people who next believe that blood thinners cure this and that, will we have blood thinners over the counter? Will we have fentanyl over the counter? Where do we stop this where we have people experimenting on themselves? And it's mandated medical malpractice because this law would be having a group of politicians, non-doctors, forcing our state medical director to write a prescription when it would be malpractice for any doctor to write a prescription for this to be used carte blanche for any reason. That would be malpractice. You would go before the Iowa Board of Medicine for malpractice. And this bill is a group of politicians forcing a medical director to commit malpractice, and then forcing pharmacists to commit malpractice when a pharmacist is forced to give that drug when they know it might be harming that patient. Think of the ethical and moral situation of these pharmacists when they know this patient might have long QT syndrome or a drug that they're already taking that might interact with ivermectin or hydroxychloroquine. And yet, because this group of politicians in this capital is forcing them to give it to that patient, that pharmacist has to harm them against the oath that they took. There's a part in this bill that also says no records shall be kept. No records shall be kept from the dispensing of this drug. Why? Is it so that we don't find out 5-10 years from now how many people were killed because of this policy? Why else would there be no records, mandated that no records could be kept when these drugs are dispensed? This is one of the most reckless, dangerous bills I've seen. I'm shocked it even got a subcommittee. This needs to go in the trash immediately. I oppose it.
Thank you. Thank you, Doctor. Representative?
Yeah, I have some strong concerns about the bill as written as well. To me, it really hones in on two words: shall dispense. Pharmacists have a corresponding responsibility to ensure the safety and appropriateness of every prescription that they provide to a patient. That's the core of the professional autonomy of the profession. And so then there's no other place in Iowa code that we force healthcare providers to do something like that and to provide a specific treatment. Also, what's different now that wasn't there in 2020, 2021 is pharmacists are able now to have their own prescriptive authority. So I question the need for something like this. We also last year passed a bill out of our chamber about medical conscience and about protecting providers from providing treatments that they believe is against their conscience. And I do see a conflict with this as well. I worry about the precedent when I see other states having bills that force pharmacists to dispense abortion drugs and what that does with medical conscience. So the bill as written, I do have some strong concerns about.
Okay. I'm just looking at some things that are very recent, over the counter. At least I was. Hang on just a second here, guys. Obviously, we've already mentioned Tylenol, ibuprofen. These were not over the counter at one point, right? There's a long laundry list that apparently I did have. The pill, Narcan. Some of the things that I can't pronounce here. Nasonex, Pataday, Splice. All of these things used to be behind the counter. Now they're over the counter, right? And so I would urge, if there are any concerns, like if there's some language concerns like shall, or if you like to modify that as we move this bill forward, I think I'd welcome your input. But I think we'd be living in a fantasy world to understand that the opposite of what was just talked about was not true during the COVID period, where pharmacists were told not, and doctors were told not to prescribe certain pills, certain prescriptions. Dr. Abby had to move to another practice because of her 100% success rate using ivermectin. Was considered against the rules, so to speak, by the medical board, and had to change professions and drop her practice. We were down here when we heard all those stories, and we heard doctors, not all doctors believe the same. We heard doctors yelling and screaming, and please give us some protection, and we did that. So I'd like to move this bill forward. If there are any concerns, we can address those concerns during the amendment process. So are there any other questions, comments, issues? All right, I would just ask my colleagues, obviously you've mentioned you're a no. I'm going to move this forward. If there's any concerns about any modifications, I'd love to hear from you. Thank you.
Representative Crawford, are you moving to go forward also?
I will have conversations with Eddie.
Thank you. Meeting's adjourned.